I'd like to call to order the paramedic service for October the 4th. And is there any declaration of pecuniary interest? I see none. We have 2 action items and 1 information item. So we'll start with the lease agreement renewal first. Michael.
Thank you, Mr. Chair. Mr. Chair, we're making a recommendation that a bylaw be introduced authorizing us to extend our lease at the Port Elgin Ambulance Station. We have come to an agreement with the landlord and are able to enter into this agreement with a 3% increase in cost. It would see us be paying a $2,386.43 per month lease payment for a total of $28,637 over the year.
Is there any questions? Go ahead. No? None? Okay, I'll read the recommendation that a bylaw be introduced authorizing execution of the extension to the lease agreement for the Port Elgin Ambulance Station between the Corporation of the County of Bruce and Joanne Weisholm Lee. Moved by Milt, second by Ann. All in favor? Carried. Okay, next, there are transfer to reserves.
Mr. Chair, we're seeking approval to that $25,000 from the sale of ambulances and $117,498 from the 2018 provincial base funding adjustment provided to paramedic services, that this be placed on reserve for future consideration. This recommendation is based on the provision that there's going to be a departmental surplus this year, which would allow this for $142,498 to be put into our reserves.
Okay. I'll read the recommendation that approximately $25,000 for the sale of ambulances and approximately $117,498 from the 2018 provincial base funding adjustment be transferred to paramedic services capital reserve for future projects, and that this recommendation is based on the provision that there is going to be a departmental surplus at year end, and it will cover up to a total transfer to reserves of $142,498. Moved by Mitch, second by Janice. All in favor? Carried. Oh, yes, sorry. Yes.
With regards to percentage funded by the ministry, where are we? Are we 50-50, 48%? Do you know, Michael? Or?
Sir, as I understand it, it's a 50%, or it's a 50-cent dollar that we're reimbursed for.
Through you, Mr. Chair, it is up to and including the capital side of the program, so it doesn't quite work out to be 50-50. It's a little bit, we get about 51.5% is what the average is. So there's a portion of the fixed asset part of the program that they fund, the capital program, they fund more than 50-50.
So the reason we got this increase was because of?
This is a normal adjustment for the year that the province are typically 4 months behind our timeline for our budget. So we submit and then they forward the adjustments usually in about June or July.
Okay, so if we know they're coming, we don't work that into our budget, right?
Yeah.
But we know they're coming.
Correct. Because we don't know what the value is going to be. Sorry, through you, Mr. Chair, and through the director, that the ministry never announce at the start of the year what the value will be. So we always take the conservative approach, and then whatever they provide, then.
And don't budget anything.
Yes.
Right?
That's right. Yeah, that's right.
Okay. I guess we'll move on to the information item, the service awards.
Sorry, through you, Mr. Chair, we just need a vote on the recommendation. You have the mover and the seconder of
Okay.
of Councillor
Okay, we had a move and
Tulin.
a second. All in favor? Carried. Very well.
Mr. Chair, it's my pleasure to advise you that 3 of our staff this year received the Canadian Emergency Medical Services Exemplary Service Award. This award is given to paramedics who have been in the field for 20 years, 10 of which have been in harm's way. This is a reward that's given carefully, having to be vetted through the employer, then a provincial committee, then a national committee, and then in the Hall of Honors in Rideau Hall. Having gone through that rigor this year, Paramedic Judy Fuller, Paramedic Paul Wilson, and Deputy Chief Ray Lux received their medal from Lieutenant General Richard Romer on September 20th at the Ontario Association of Paramedics meeting, and I wanted you to know that those fine staff are working for you.
Well, that is really good news, and we congratulate them for all the services that they fulfill and staying with the Bruce County for those number of years. This is really good news. Anybody have any comments? Go ahead, Mel.
Yeah, I had a chat with Michael maybe a couple of weeks ago about this issue. And I've had it expressed to me where at times, there is a critical shortage of both vehicles and staff. And I would just like some response in the minutes or somewhere about this issue.
If I may, Mr. Chair, we keep an eye on the deployment of the ambulances and on their usage on a daily basis. When the ambulance service gets to 3 ambulances left on the peninsula, it is a notable event which receives a report. This happens with an irregularity, which is not something that we can predict. The number of times we've gone below 3 to 2 to 1 to none, well, our numbers on that are not high. I can tell you that I cannot remember a time when we have had a call delayed due to an ambulance not being available. To be clear, if there is only 2 ambulances available on the peninsula, notwithstanding the call will be responded to, it will, depending on its location, it will be a longer response time. So there are times in our service, as in every ambulance service or paramedic service, where the demand will just exceed our resources, such as cases with multiple vehicle collisions or what have you. But we are watching this, and we do fall from time to time into those areas of rare coverage, but not to the point where all are gone. But we do have those moments of challenge.
I'm not referring so much to the peninsula in particular. I don't think it's the system that the concern was expressed about.
I'm sorry, that would, in the catchment area that I may have misspoken, in the catchment area that the county of Bruce.
Right. That's okay. That's what you're
yeah.
referring to. So a critical shortage would be, what does that mean?
I would suggest, sir, in the literature that there's no common understanding for what that would be. I would suggest that it is something where you would have on an ongoing and predictable way periods of time where you do not have ambulances sufficient to meet the call demand.
Okay.
Now this can happen in cities, whereas you know ambulances are being held hostage, if you would, in emergency rooms, because the emergency room cannot take transfer of the patient away from the ambulance. And as a result, ambulances can be in emergency rooms for hours before they can discharge a patient. In the meantime, there's calls coming in. We do not have that effect here to a significant level unless we move into the cities.
Go ahead, Janice.
What you just mentioned, the waiting time in emerge is a huge issue in some areas. Is there any movement to reduce that or to create the ability to transfer that responsibility to the hospital sooner than having to wait and emerge for 3 or 4 hours?
There are ways to do it. I cannot, and there's a number of places have had some success. An example, Mr. Chair, would be to have nurses assigned to ambulance or paramedic cases when they come in. In other words, you're staffing outside into the hallways, or you're actually employing paramedics to take care of the patients when they come in so it can discharge the ambulance. There are ways to do it. There is the central issue that the hospitals are full and that there's a lot of people without physicians that have to go to emergency rooms to see a physician. So there are a number of confounding issues that contribute to that.
Through you, Mr. Chair, if I may ask, Director Mike, could you comment on the bigger issue we have in terms of hospitals using the ambulances for transporting patients for tests?
Yes. Mr. Chair, in answer to Madam CEO's query, or CAO's query, the government has put in place, or the LHIN has put in place a structure where non-critical patient transports are done by a third service. You would see yourself taking this service if you were in stable condition and you needed to be treated at another hospital. You did not require emergency paramedic oversight. This service has been in demand increasingly within Bruce County, seeing sometimes patients waiting inordinate amounts of time to be transferred to another facility. On occasion, hospitals have asked the paramedic service to backfill that service. And we're working with the LHIN and the government and the provider to look at how we can stay away from that business, because further to a previous question, Mr. Chair, that would be another additional drawdown or demand on the system. So we are meeting, we've had several meetings with officials for the LHIN, ourselves, Grey County, and the ministry to figure out how we can make sure that all stay within the criteria which is currently in place to make sure that emergency ambulances are not used inappropriately for these transfers that can be dealt with by other people.
Okay.
Just for excuse me, through you, Mr. Chair, just for clarity, that's as a system, that's our bigger issue versus having paramedics sitting in emergency rooms, is that we have hospitals making arrangements for tests to go to, for example, St. Mary's in Kitchener. And so we have ambulances that are out of the area for half of a shift because they're transporting a stable patient to a hospital to have a test performed.
Go ahead, Janice.
So this is happening now, or they're asking us to take on this? This is happening now. I had no idea. I thought that, what was the name of the company that does the third party? Voyageur, yeah.
Right, yeah.
So are they
Voyageur
understaffed too? Is that the problem? Voyageur can't keep up with the demand?
There have been days, Madam Chair, where they've certainly, the demand has outstripped their resources that have been assigned to Bruce County. I can't speak to that, sir. I don't know.
Wow.
Janice, yeah, or Ann, you have a comment?
So the third-party company, or Voyageur, or another company, in certain cases, do they provide sure the patient is stable, but sometimes don't they need somebody with medical background to accompany them? And do they provide that medical person, the third-party companies, or in their, so I take it they have, this third-party company has ambulances that are suitable, not just some rickety old vehicle?
Mr. Chair, they do. To be clear, if the patient is critical and needs our level of care, we will provide that, given the fact that
Sorry, pardon me.
we will take those calls.
Oh.
Because the scope of practice is within our scope. It's something that the patient needs, the continuity of care. We can provide that. Voyager cannot. And we will take those sick patients to another hospital. If it's beyond our scope, Orange will be brought in to fly the patient to those locations. So again, to be clear, Mr. Chair, the issue is that if the patient is of low acuity and can be dealt with by other people or other services, and we get called and are pushed into that situation, it's something that is inappropriate, and we're working through processes to make sure that the criteria that exist is dealt with and stayed within on a current level, or on an ongoing level. If you're minor, it's a Voyager. If it's a complex patient, yes, we'll take it.
Okay, because some are stable, like I'm thinking of a certain...
Yes, the vast majority
with,
are. Yeah.
a heart attack, they're stabilized, but, it's just not guaranteed stabilized all the way to the city.
And when these patients are sufficiently sick, they will be our care will be supplemented by staff from the hospital that will help us escort the patient to the other facility.
Okay, thank you.
So just to be clear, Voyager cannot transfer a patient that's critically ill where one of our paramedics go in the Voyager vehicle. Our own ambulance would take that person down.
That's
True?
correct. We would travel in our own unit with our own staff.
Okay, so can Voyager take like a registered nurse or somebody from the hospital to accompany that patient down?
I can't speak to the protocols, Mr. Chair, of Voyager at this time. I don't know their rules of engagement with the LHIN.
Because that'd be nice if they could do that to keep our ambulances here. Go ahead, SCO.
Through you, Mr. Chair, this it's an item that's worthy of an agenda item. This is not an agenda item at the moment, and given the general interest around the table, staff would certainly be happy to bring back an information report for clarity for everyone.
Yes, I think that's a very good idea. This could be a very expensive, in the future, as our population keeps increasing, we're going to need more ambulances, more staff, so maybe this is something that we should really be looking at for the future. So is there any other comments or questions? Janice, go ahead.
Would Judy, Paul, and Ray be recognized tomorrow then at the banquet?
I don't believe they will, ma'am, because it's a different theme.
Okay. In the service.
Huh? Yeah. Okay, any other questions or comments? Okay, next I'll read this here, that in accordance with the procedure bylaws, staff be authorized and directed to give effect to the actions of the Paramedic Service Committee in respect to all resolutions passed during this October 4th meeting. Moved by Milt, second by Ann. All in favor? Carried. Next, I need a mover and a seconder that we do now adjourn to meet again on November the 1st. Moved by Janice, second by Mitch. All in favor? Carried. We are now adjourned.